once again to my YouTube channel, and in succession to the videos what I have been uploading on general medicine. So today's topic of the discussion, in succession to the previous video where I have discussed about the clinical features. So the clinical features and what is lung abscess, the definition of it, I have already discussed. So in this video, I'll be discussing about the investigations and the treatment modalities for lung abscess. So actually, in the previous video, I've already discussed that lung abscess is caused due to due to the pyogenic bacteria, and when the pyogenic bacteria gets aspirated from the oropharyngeal secretions, or whenever there the patient whenever there is loss of reflexes, when the swallowing reflexes are hampered in any way, when the patient is unconscious or whenever the patient is in alcoholic condition. So in such a situation, there might be a possibility that the oropharyngeal secretions, particularly of the dental and the periodontal origin, these secretions, what happens is these secretions, they mostly enter and into the windpipe through the trachea, and they enter into the lungs. So these bacteria or the foreign bodies, whatever aspiration is there, this bacteria, whatever they are present in the oropharyngeal secretions, if the reflexes of the coughing are lost, so ultimately they can reach they reach into the lungs, and they cause this kind of an infection. And once this, it is a pyogenic infection, so bacteria what are basically responsible for this lung abscess, these are the streptococci, the Klebsiella, and the staphylococcus. So particularly the staphylococcus aureus, this infection, it is mostly associated with the lung infections what are occurring, the lung abscesses what are occurring in children. So viewers, do remember, starting with the investigations. So in the previous video, I have already said it is the pyogenic bacteria which are the causative agents for causing lung abscess. So firstly, the most important diagnosis what the doctor is suggesting in cases of lung abscess, it is the chest x-ray. So doctor will advise you for go for a chest x-ray, and there, by just observing the chest x-ray, the doctor can make out that where the area of the radiolucent area which can be having a very well circumscribed lesion, so where the pus accumulation is there, and where are the site which lobe of the lung is affected. So that area, that particular site, the doctor will make out by conducting the chest x-ray. Once the area, the lung, what is affected, because the radiolucent homogeneous density can be visualized in the chest x-ray. So the next step, the doctor will advise just to see that where the pus localization is there, and how much, which areas are having those vesicles of pus accumulation. So the next step, the doctor can advise for a CT scan of the chest. So the chest CT is done, computed tomography. So chest CT is done. Apart from this, the doctor, since it is the patient is discharging in lung abscess, the patient is mostly coughing out mucopurulent secretion. So that is containing mucus material as well as the purulent discharge is also there. So once the mucus and the purulent discharge is there, so this purulent discharge is due to certain bacteria. So the doctor is going to advise for sputum culture. So whatever the cough the patient is expectorating, so that sputum culture will be taken, and those culture and sensitivity test will be conducted for this sputum. So on microscopic examination based on gram staining, the acid fast bacilli, because this lung abscess can also be there due to a tuberculosis infection if the pharyngeal secretions enter into the lung. So they can also rule out certain the gram stains technique, and based on the culture and sensitivity. So based on this, the doctor is going to prescribe certain antibiotics to treat this lung abscess. Apart from this, the doctor will ask the patient for have a complete blood cell count. So in the complete blood cell count, the doctors is more preferably going to visualize about the total leukocyte count as well as the differential leukocyte count, because it is actually whenever a foreign body, a pathogenic bacteria, a pyogenic bacteria is going to enter into the alveoli, the distal terminals of the lung. So actually what is going to happen is there is the leukocyte infiltration is there. So once we do with the total leukocyte count or the differential leukocyte count, once the doctor is going to see these reports, so he can find obviously there is certain kind of an increase in the leukocyte count which can manifest in the form of leukocytosis. So there is a leukocytosis might be present in the complete blood cell count. Apart from this, the doctor is going to visualize about the total leukocyte count as well as the differential leukocyte count. Apart from this, there can be increased polymorphoneutrophils, and polymorphs will be elevated on seeing the blood cell count. So firstly, the sputum culture will be there, the blood investigations, the doctor will ask for it. Apart from this, the doctor can also perform the procedure what is called as bronchoscopy. So bronchoscopy, it is such a procedure in which a thin tube which is containing a light and a camera is inserted into the lungs just to visualize where the foreign body is, or just to take out the sample for culture and sensitivity. So whatever the mucopurulent discharge is there, just to take it out, or if any foreign body aspiration is there, with the help of a bronchoscopy, with the help of a bronchoscope, the causes of lung abscess can be ascertained. Apart from this, once the sputum or the particular sample of the sputum or the mucopurulent discharge is taken out from through that pipe through the bronchoscopy procedure, we can go for the gram staining. We can the doctors will go for the microbiological tests such to ascertain that what are the pathogenic microorganisms what are associated with that particular individual, so that a specific antibiotic treatment regimen can be started. Now, apart from this, when we observe the chest X-ray, so in the chest X-ray, the doctor is going to visualize a certain localized shadow. So, a particular shadow in the form of a radiolucent lesion, and that particular shadow will be having a homogeneous density. So, if it is a case of a acute lung abscess, in cases of an acute lung abscess, what is going to be seen is the radiolucent area is somewhat very homogeneous, and that homogeneous, it is well circumscribed, its margins can be very intact, and if it is a chronic case, it can appear either in the form of star shaped or irregular radiolucent areas. So particularly the chest x-rays will show a shadow having a homogeneous density. So these were all about the investigations. Now we'll move on to the treatment modalities. So what are the treatment modalities what are associated, what can be done for a patient with lung abscess? So when in professional exams, you can be asked as a separate question that mention about the treatment modalities for lung abscess. So firstly, it is the palliative treatment. So in the palliative treatment, what do most of the patients, the doctors suggest that they ask them to have a complete bed rest. They should have bed rest. Apart from this, oxygen can be delivered to them through an hospitalization or through an oxygen mask. Apart from this, the doctor advises them to have a high protein diet. Just because of the lung abscess in the later stages, if the patient is reporting, there might be that the patient is going to lose weight and the patient is having a loss of appetite. So that will result in generalized wasting of the muscles and body. So apart to manage this, to cure this, the doctor is going to advise about the high protein diet. Now moving on, since it is an infection, it is a pus what is localized in the lung parenchyma. So actually the doctor is going to make the patient abstain from exercises. So the exercise is avoided. The patient recommends, the doctor is going to recommend to the patient that he should avoid exercises. Apart from this, depending upon the culture and sensitivity. So the sample, the mucopurulent sample, the cough, what the patient has expectorated, that can be even sent. Apart from this, through the bronchoscopy, what the mucopurulent sample the doctor has taken out, that can also be sent to the microbiological labs for culture and sensitivity, and based on the culture and sensitivity, the specific antibiotic treatment. So specific antibiotic treatment particularly through the intravenous route, that is the parenteral route. These antibiotics can be prescribed to the patient, particularly the beta-lactam antibiotics So the beta-lactam antibiotics with that is the amoxiclav or amoxiclavulinate. So these can be prescribed. Apart from this, the cephalosporins, the erythromycin, the ampicillin, the amoxicillin, they are firstly injected through the parenteral route. That is through a drip, through an intravenous route. The doctor is going to inject these antibiotics depending upon the culture and sensitivity of that particular patient. Now, moving on, the next treatment modality is physiotherapy. Now, what do we find in physiotherapy? That in physiotherapy, in cases of a large lung abscess, so if the lung abscess is quite a large and the size of the lung abscess is actually more, if it is more than 6 centimeter, so in certain cases, in cases of large lung abscess, if the size is more than 6 centimeter, so postural drainage is also recommended. So through physiotherapy, this postural drainage can be done, and if this postural drainage is once it is carried out, so actually this can help to take off the excess of the pus what is being accumulated in the lung. And a last resort for this such a treatment of lung abscess is surgery. So if all the above, the palliative treatment, the antibiotic therapy, the physiotherapy, so if all such modalities have failed, then the doctor is going to suggest for surgery. And in surgery, if there is no response to antibiotics is there, if there is if massive hemoptysis is there, the patient is coughing blood too much excessively. So if all such measures fail, if massive hemoptysis is there, apart from this, if it is a malignant condition and it is occurring the bronchiectasis, so there is narrowing of the bronchioles. So in such a situation, the doctors will go for surgery, and even the part of the affected lung can even be removed, or in extreme cases, if it is very wide, so the entire complete that lobe of the lung can even be removed. So these were the treatment modalities, that is the palliative care, the next is the antibiotic therapy, the next is the physiotherapy, and the last it is the surgery. The last method, last resort is the surgery. So students and viewers, this was a very short discussion where I have discussed about the investigations, what needs to be carried out for the treatment of lung abscess. Apart from this, what are the treatment modalities and how the lung abscess is treated. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe. If you like this video, give this video a thumbs up, and thank you for watching.